What triggered you to look into longevity, and what triggered you to say, look, there's something here. Let's do some research around fasting and longevity?
Yeah, so I always show these slides and I start with the risk factors for cardiovascular disease and Alzheimer and cancer. And you see obesity and smoking, right? So obesity and smoking are the top risk factors. And then I show the next slide and I show obesity and smoking compared to 30 years of aging, and they disappear. So obesity and smoking disappear as a risk for cardiovascular disease, cancer, and Alzheimer compared to 30 years of age. There's so little that you cannot even see it. So that's why that answers the question why longevity. It's like that's it. If you can treat only one thing, treat aging. Almost everybody is 20 years old is perfectly healthy. They could have a terrible diet and smoke, but they're 20 and they're still very healthy. So that answers that. And then fasting. I hate the word fasting, and I think it's doing as much damage as it's doing good because it's used as a word, right? It doesn't mean anything. So what are we talking about, right? And who are we talking about? So I think now we're seeing what I knew was going to happen. We're seeing the anti-fasting movement, right? So there's a fasting movement, and now we're starting to develop the anti-fasting. And because people are saying, rightly so, there's a lot of problems.